Hi guys, welcome back to the channel. So we have completed with benign lesion या benign neoplasm of bone. Now we'll be starting with malignant neoplasm of bone. Hope your weekend was good. Let's start today's topic. Malignant neoplasm of bone. First is osteosarcoma. Clinical presentation and pathogenesis. Represent malignant neoplasm arising from mesenchymal stem cells and or their early progeny. या तो mesenchymal stem cells खुद या their early progeny. Their partial differentiation leading to production of tumor bone from a malignant cellular stroma is what defines them as osteosarcoma. So there is partial differentiation which lead to the production of tumor bone from a malignant cellular stroma. It is related to loss of p53 tumor suppressor gene, development of independence from regulation by platelet derived growth factors, and loss of retinoblastoma tumor suppression gene. So three of the genetic things are involved mainly. First is loss of p53 tumor suppressor gene. Second is development of independence from regulation by platelet derived growth factor, and third is loss of retinoblastoma tumor suppression gene. The age is between 10 to 40 years, but in jaws is mainly seen that peak year is 37. Present with an expansion of bone. Incidental radiographic finding. It is the incidental radiographic finding of a radio-opacity, a widened periodontal ligament space, that is Garrington's sign, a mobile teeth, a numb limb, or paresthesia and or paresis. Okay, so there is a radio-opacity with a widened periodontal ligament space. This is very important, or the peculiar feature, or the feature seen in mostly all osteosarcoma, that is Garrington's sign. A mobile teeth, numb limb, or other paresthesia or paresis. Now, male and female are equally affected in jaws. Mandible is more commonly affected, that is 60%, than maxilla. Osteosarcoma, also known as juxtacortical osteosarcoma, arise from periosteum and occur outside the cortex less than 1%. Okay, it accounts for less than 1%. Periosteal osteosarcoma, that is also known as juxtacortical osteosarcoma, accounts for 1%. Now coming to the radiographic finding, the peculiar finding of all sarcomas are sundry appearance. Now, Garrington's sign is most commonly seen in osteosarcoma. We have seen widening of pedial space, that is known as Garrington's sign. It is most commonly seen in osteosarcoma, but sundry appearances are seen in malignant lesions or in sarcomas. Now, radiograph and CT scan shows a mottled radio-opaque or mixed radiolucent radio-opaque appearance in medullary space. या तो mottled radio-opaque दिखेंगे या mixed radiolucent and radio-opaque appearance. Extracortical bone formation is common and cortical bone destruction is characteristic. एक्स्ट्राकॉर्टिकल बोन फॉर्मेशन होगा और जो कॉर्टिकल बोन है उनका डिस्ट्रक्शन होगा, दैट इज कैरेक्टरिस्टिक ऑफ osteosarcoma. Maxillary osteosarcoma produces a sundry appearance and extracortical bone formation very less frequently. It's very less frequently. They also grow into air spaces of maxillary sinus as a bulbous radio-opaque mass. So they grow into sinus spaces as a bulbous radio-opaque mass. Now, the pluripotent mesenchymal stem cell can give rise to all connective tissue lineages. The bone lineage can become neoplastic at any stage. The earlier the stage, the more malignant the cell and the high-grade tumor. And the later the stage, the more low-grade and even benign tumors present. Okay, that's all for today. We'll be starting from here from the next class, and we'll be continuing with osteosarcoma. Till then, like, share, subscribe and comment. Bye.